What about abnormalities in the size of the pupils and how briskly they react? Okay, so how do you check for the size of the pupils? You need to illuminate those pupils with a light source, a bright light source. Hence the need for a pen light or a cell phone if that is what is available to you. So you check the size of the pupils in the well-lit place and in the dark place. So they should adjust the size relative to the amount of light in the room. Okay, if you turned off the lights, then you see this woman's pupils dilated, because of the absence of light. Right? But if you switch on the light too bright, lilit siya, no? Compare, you turned on the bright light, so the pupils constricted to light. So now outlining for you the normal shape of the eyes and the eye in the iris, the pupils. If you shine the light on this pupil, it is reactive to light, so that is a normal finding. It should be reacting right away, so briskly reactive to light. You transfer the light source to this pupil right here. The pupil also constricted. So right eye, left eye. So they should both constrict. So this is just an illustration. It means that if I shine the light here, the size of the pupil here should be the same as the pupil size here, and same here as well. This is just for illustration purposes. This is not real time. Okay, so the normal finding would be pupils that are equally and briskly reactive to light on the direct pupillary reflex. So mediated by that midbrain structure, not the Edinger-Westphal nucleus. So what we're seeing in a patient at any point in time is that the autonomics are in a state of balance, meaning the parasympathetics, which are controlled by your oculomotor nerve, are equal to the sympathetic tone coming from your hypothalamus. So it may fluctuate. You may see it in your own eyes or in another person's eyes, where the pupil size will fluctuate from small to slightly enlarged. That's called hippus, Hippus. Okay, so what happens is you'll see more of this in ophthalmology and in the head and neck module. You have a constrictor muscle in your iris, and you have a dilator muscle. So something that dilates. So this is under sympathetic control. This is under the oculomotor's parasympathetic control. So what is the abnormal pupil if you have a differing size of pupil? So anisocoria means same size pupil. Anisocoria means the absence of the symmetric size pupils in this case. So which is the normal or abnormal pupil in this case? It depends on the light source, depends on the reactivity to light. So let's say you shone the light on this pupil right here. It doesn't seem to react. If you shone the light here, it constricted. Again, this is not real time. We don't know yet if this reacts. That's why you have another flashlight ready to check if this one constricted when you shone the light here, and if this one constricted if you shone the light on this eye over here. So the one that is sluggish, and this one you can only tell if you're right there together examining with someone examining the patient. The sluggishness of the pupil is the sign that that pupil is not normal. So a pupil that does not react briskly is the abnormal one, and they'll usually be the larger size pupil. So the large pupil is called mydriasis. So it's usually a right oculomotor nerve lesion. Okay, so the moment they're is a problem with the parasympathetic, like a compromised oculomotor nerve, then what wins is the sympathetic side. So if the sympathetic side is unopposed, then the pupil will dilate and relative to the other pupil that you see here. That's because the pupil here failed to constrict. So if the constrictors fail, the dilator wins. So again, which is the abnormal pupil? The answer is it depends. Like for this pupil here, it's larger than this one. But when I shine the light here, it constricts. Shine the light here, it also constricts. So they are both constricting. So what does this mean? The constrictors are working, but the sympathetics seem to be stronger on one eye, or it means the strong sympathetics is weaker in one eye. So which is the abnormal pupil in this case? The abnormal pupil in this case is the smaller pupil. It means the sympathetic tone on this side is less than the sympathetic tone on the normal pupil here. So in contrast to mydriasis, this is meiosis, meaning a small pupil, a part of the so-called Horner syndrome, which is an autonomic problem, which Dr. Dasig might have mentioned. So Horner syndrome means a problem in the sympathetic system on one side of the body. So here, the parasympathetic tone wins over the sympathetic tone because there's a problem with the dilators on the left side here. Okay, uneven palpebral fissures. This is just a fancy term for mas maliit ang mata sa isang side. Like in this case, so which is the normal side? Which is the abnormal side? Again, it depends on your examination. But for this case, normally your palpebral fissure, which just means the hole between eyelids, palpebra means eyelids, fissure means groove or hole. Here, the iris is always unobstructed with a normal eyelid. With the ptosis, or drooping eyelid, the iris is partially covered, so you cannot see very well with this eye. So this is what the patient would already complain of when they consult you. They'll say, bumabaksak yung talukap ng mata here on this side. So again, since you are still far away from the head and neck module, I'm just introducing you two different muscles here. This is the main muscle of the eyelid. This is what raises the eyelid. This raises your upper eyelid. So the term in Latin is levator palpebrae superioris, meaning what elevates the upper eyelid is this muscle here, and this is his tendon inserting on this connective tissue over here. So what does it do? It pulls up the eyelid like this. That's the function of your levator palpebrae superioris. So the rule is your iris must not be covered by the eyelid. Okay, so in this case, is it a problem with the levator palpebrae or something else? So the answer is the problem here is the levator palpebrae, because that's the function of the levator palpebrae. It makes sure that your iris is unobstructed by your eyelid. That's its function. So in this case, this patient has a problem with his levator palpebrae superioris. In Latin, ptosis, silent P. What about this case? Here you have uneven palpebral fissures. So you examine this eye. Well, the iris is okay here. And then you have this eye. The iris is also covered, but you still see enough iris here compared to the previous patient. You can barely see the iris anymore. So in this case, there is a narrowed palpebral fissure on the left side, and you will see on the examination by making them do the EOMs that it's really just a mild droop of the left eyelid. So what's the anatomical basis for this? Aside from that levator papillae superioris, there is also a thinner muscle beneath it called the superior tarsal muscle. It's an accessory to your levator palpebrae superioris, and this one is under sympathetic nervous system control. So what does it do? So when you're excited, no, so when you're at a normal state of mind or emotion, it helps maintain the tone. No? So it tells you how excited you are. That superior tarsal muscle. But if you're extremely agitated, like this, so that extra white of the eye seen here is because of your superior tarsal muscle. Okay, so that explains that here, the problem here is the superior tarsal muscle, which is sympathetic, and if you examine the size of the pupils, this pupil also happens to be smaller. So this person here has a Horner's syndrome. Again, a sympathetic nervous system problem on that side.